Good afternoon and welcome to the Mobility for All Coordinating Coalition. We have a wonderful agenda today and I just want to welcome you all. We have a 30th anniversary of the Americans with Disability Act panel discussion. So I'm really looking forward to it, but I'm going to do some housekeeping before we get started. Can everybody see my presentation? Okay, great. So just to go over a couple of housekeeping items before we get started. You'll see here that there's 3 different ways to join Microsoft Teams. Since you're here, I'm assuming that you made it, but just in case you get kicked off for whatever reason, there's a couple ways that you can join. You can either join using the app, which you would download, and then click on the Join Microsoft Teams. You can also click on the Join Microsoft Teams and then open it up in your web. So if you're having some problems with the app, please feel free to join it in the web. I am going to mute everybody at this point, and then you can unmute yourself when it's time to talk. Okay, can everybody hear me? Did I mute myself or can you hear me? You're good. Okay, great. And then if you lose connection for whatever reason during this call, please, you can call back in using your cell phone number. And if you click on the meeting invite that you may have received, it should automatically enter in the conference ID code so that you don't have to remember that and enter it in. But if you do, you can write it down and then enter it in separately. So I will go over some of the functionality of Teams before we get started. So we ask that people use their video if you feel comfortable. This really does help with communication and help us see your face and connect. We know that during this time of COVID, it's really hard for us to get to connect with people. So this is a great opportunity. If you don't feel comfortable using your video, we understand that. Also, the mute button is on the bar in the middle, and I will mute people if there's some background noise. The reason why is because we get into some of these echoes occasionally, and it gets hard to hear some people who are speaking. Just click on that unmute button though if you have something to say and you would like to unmute yourself. Additionally, there's the chat function, which is this little call out icon here. And if you all can enter your name and the organization or the location that you're joining us from, that would be wonderful. This helps us with our meeting minutes to know what our reach was and who we have on the call. Additionally, you can see other people who are on the call by clicking on the person icon. So there's a couple new features. You can use live captions during this call, but I believe you do have to have the Microsoft Teams app versus going through your browser. So if you're having a hard time understanding people, this might be a good option for you. Additionally, I know that during this time, sometimes we have slow Wi-Fi, we have technology difficulties. So feel free to turn off the incoming video if you get to the point where everything's just kind of choppy and you can't understand what people are saying. This will help with the bandwidth that you have on your end. So that's the option there. Additionally, I'm just going to ask you all to type in the chat your name and organization. This does help us understand who we're reaching and who's present on the call. And I want to just kind of go over the reason why we're all meeting and just a little housekeeping information. So this is the Local Coordinating Council, which is a coalition of nonprofits dedicated to accessible, affordable, and equitable transportation options. We meet every month on the second Monday of the month from 2 to 4. We're holding virtual meetings due to COVID-19, but typically we would do odd months in Longmont and even months in Boulder. Really, our purpose is to bridge the gap between transportation and housing and human services. We really look at transportation as essential to accessing all other aspects of your life. So we really put transportation as that linchpin service right in the middle of the pedal graph that you'll see in the upper right-hand corner. It's essential to accessing employment, food, nutrition, health and well-being. It's essential for environmental health, education, safety, and then also housing stability. On the bottom, you'll see a continuum. We use the framework that Housing and Human Services uses around transportation called the self-sufficiency matrix. And we really want to see people are in the stable, safe, or thriving area of this continuum with their transportation options. We find that if people only have one mode of transportation that they depend on, that they can be very vulnerable. And if something happens to that one mode, then they possibly will miss a crucial health appointment, doctor's appointment, or they can't get to their job. So we really want, through multimodal transportation access, we want people to get up into the safe and thriving section of the continuum. So we do have a pretty full agenda today. We're going through the welcome right now. We're going to have the 30th anniversary ADA panel discussion. After that, we'll have the local coordinating council updates. We'll talk about the technology workshops that we're conducting, the new Ride Free Lafayette service, some grant coordination for projects that are upcoming. We have a new transportation provider called Key Transit that would like to talk to us. And then we also have a demonstration by the Denver Regional Mobility and Access Council on their new app. And then RTD has two presentations that they would like to give to us. One is on their response to COVID and how their services have changed since the COVID pandemic. And then the next is Reimagine RTD, which will really look at the next future of RTD and how they're going to be able to deliver services. So given that, I would like to make sure that all of our panelists are on the call. So I'm going to go ahead and introduce you one by one and just unmute yourself and say hi. So first, I'd like to introduce Judy. Are you on the call? I think you're on mute, Judy. Okay, I can see you on the call. So we'll come back to you when we do introductions. So I don't think I'm going to be able to unmute you. So I apologize for that. Next, we have Jamie Lewis. Jamie Lewis, are you on the call?
Yes, good afternoon.
Good afternoon, Jamie. Next, we have Eugenia Brady. Are you on the call, Eugenia?
Yes, I am. Hello, everybody.
Hello, welcome.
Thank you.
And next, I have Aaron Pastors. Aaron, are you on the call?
Yes, I am. Hello, everyone.
Hello. How are you?
I'm good.
Great. And next I see that Judy is going to be able to unmute herself. So just say hi, Judy. There you go.
Okay. Hello, it's nice to be here.
Nice to see you, Judy. Thank you so much. So I reached out to our panelists over the last month or so, just to talk to them a little bit about their personal experiences with the ADA. So we're going to go ahead and start out the way that this is going to go. We have about 4 questions. I have the first hour of this meeting set aside so that we can hear about their responses and their impressions of the ADA. And I will go ahead and call each one of them out. That way we don't have people speaking over each other. But we'll go ahead and start with you, Judy. Judy, you are with the National Federation of the Blind, the local Boulder chapter. Can you please take a moment and introduce yourself and let us know a little bit about how ADA has impacted your life?
I can, and I'll start by saying that I'm on a new computer and ADA and Microsoft Teams are not my favorite combination at this moment, but is my video on?
It is, yeah, thank you.
Because I can't do anything with it on this end. All right, well, thanks for inviting me and hello to everyone. I have been a longtime member of the National Federation of the Blind. It's actually a worldwide organization, and our organization is committed to promoting opportunities for blind people around the world. And we do that in employment and public accommodations, higher education, and everywhere. And I've been with the organization for a number of years. I'm also the former director of the Center for People with Disabilities, and that dates me by quite a bit since it was founded in 1977. And I think that's good for now.
Wonderful, thank you. Next, we're going to go to Jamie Lewis. Could you please introduce yourself and tell us how you've been involved with the ADA throughout your life?
Sure. My organization is the Colorado Cross Disability Coalition, and we support disability rights by any means. I went back a little further in my intro. I wanted to tell you a little bit about myself. My adventure started in 1961 when I contracted polio. For you that don't know me, I utilize a power chair to get around. But I grew up in a lower middle class family, so pretty much in the 60s and 70s had to compete with the able-bodied world. It wasn't until I was about 38 years old that I had the epiphany that I was disabled. Nobody told me I was disabled. So when I moved to Colorado, I started working with some organizations like Atlantis and CCDC. And it was just refreshing to know that there were groups out there that could empathize with me, provide me guidance and inspiration. So for about the last 20 years, I've been working as an advocate. And in the last 6 years, I have focused on transit. So that's where I come from.
Great, welcome. Thank you, Jamie.
You're welcome.
Next, we'll go ahead and turn it over to Eugenia. Can you please introduce yourself and let us know how you've been addressing or working with the ADA throughout your life?
Hello, everybody. My name is Eugenia Brady, and I am an advocacy coordinator and diversity specialist for the Association for Community Living. We work specifically with people with intellectual and developmental disabilities here in Boulder, in Broomfield as well, Boulder and Broomfield County. And I didn't grow up with a disability. I became an amputee and a wheelchair user almost 3 years ago. But in my personal case, when I started to use the wheelchair and get back in my life, I was very glad to see that ADA was in place already for the many things I needed to do. For instance, during the time when I needed to drive, but I couldn't do it yet. I think we are very lucky here in Boulder to have transportation services, and was happy that I could still have accessible parking places and ramps to help me go to places, including my workplace. And all these things helped me to build a new normal for me, to see that through these accommodations made in the community, I can still go to the store, doctor's appointments, visit family, and other places in the community.
Wonderful. Thank you, Eugenia. Next, we have Erin. Erin Pastors, would you like to unmute yourself and let us know, and give us an introduction and let us know how you've been involved with the ADA and how it's impacted your life?
Yes, my name is Erin Pastors. Almost for the past 10 years now. I've been, it'll be 10 years in December of this year. So I've been working as an advocate in my current role at Center for People with Disabilities. So, the Americans with Disabilities Act has been a key piece in advocacy, both individually and system-wide, when it comes to my professional role within the Center for People with Disabilities. And personally, it's been really helpful in different ways to allow access to different aspects in my own life, such as employment or such as communication, because I utilize those two aspects of the law, or two titles of the law on almost a daily basis. So it's been very beneficial in those ways, personally and professionally. Thanks.
Great, thank you. So we'll go ahead and move on to the next question. In the newsletter that I sent out today, there were a couple links to different resources. One of them was the curb cut effect. And it talked about how curb cuts have benefited, while they were initially targeted to serve people with disabilities, that they've had broader implications for people with strollers, for delivery people, and how it has impacted more people than just people with disabilities. So that was kind of an example of some of the huge strides that we've made. But we know that there's a lot of room for improvement. So this next question is really going to be talking about how can we improve on the requirements of the ADA to make communities even more equitable and accessible. And I'll go ahead and repeat this question before each person, that way you don't have to remember it. But we'll go ahead and start with Jamie Lewis this time. So can you let me know like how you think we can improve upon the requirements of the ADA?
I think the two areas that need to be reinforced is enforcement and public input. Enforcement, because most of our smaller communities, they don't really have someone that's knowledgeable or dedicated to do that function, to make sure that construction or development of projects get done properly. Unfortunately, they depend on the contractor a lot, and that's where we run into problems where somebody says something is accessible and then we come along and find out that it's not. And as far as public input, the ADA and the guidelines that have been developed are pretty flexible, and I think that what people miss is that the things that they build for their community can be basically tailored to the needs of their particular community. Every community is different. And I think it's important that we reach out to those people that it's going to affect, and get that feedback from them instead of, just doing the check off the box. Yeah, we talk to the disabled people. They really need to hear from our community what is needed and what is efficient. Thank you.
Great, thank you. So Eugenia, I'll go ahead and repeat that question. So even though we've made a lot of progress with the ADA, how can we improve upon the requirements of the ADA to make the communities even more equitable and accessible?
Yeah, I think that here in Boulder, we have many advantages, but I think that we need to do some progress in the rural areas, because the progress there for accessibility is slower than in other places. And talking about access, I think it's really good that we have access to workplaces and different places in the community, and also there is in the law that we don't get to be discriminated for our disability. But we really need to work on the employment part for the people with disabilities who are willing to work and have the opportunity to do so. We need access to that. Just like people or kids having access to higher education and training opportunities to be able to just have a job, just like anybody else. Also, I think that we can make the community more accessible. And park in open spaces. Sometimes, we have the accessible parking, but sometimes we go to those open spaces. Like hiking is one thing that I really miss, and the places, even an open space, are not really wheelchair friendly. I don't have a power chair, so I would like to see that we can go to those places, taking a walk with family around the lake or something, without the family member to just fight the ground for us to go over there around the lake, for instance. So there are many not, you could call it maybe little things, but we still need to work on those little things for for us to have access, complete access to places.
Great, thank you. So next we'll go to Erin. Erin, how can we improve upon the requirements of the ADA to make communities even more accessible and equitable?
Well, I think we can, really continue with the educational aspects of the ADA and teach people in depth really how it impacts, their day-to-day life and how it's been beneficial to not only people with disabilities, but people without disabilities, and just to keep teaching them how it plays a critical role in inclusiveness in our country, and how critical it has been over the past 30 years, and keep promoting the importance of why it exists, and how it can make our communities work better with each other together. It really it's the educational piece of why it's there, but it's also to make to try to it's kind of understanding why it's there, and having the attitude of maybe understanding instead of not not willing to learn about why this is important, to have that equal footing, or equal opportunity for others in the community, people with disabilities and people without disabilities, just a more communal society in general when it comes to an important civil rights law like the Americans with Disabilities Act.
Great, thank you. So next, Judy, can you
Sure.
let us know what you think how we can improve upon the ADA to make us even more equitable and accessible?
I think the benefit of having lived in this city and county for a long, long time, and a couple of us have done that, is that we can kind of look back and think about where we were back in the 70s, for example, versus where we are now. And it's pretty amazing. Now, having said that, sure, there's much more we can do. When I think about access, for example, to the RTD routes, in other words, where does a bus actually go? What is the map? What is its route? That's still something that we struggle with in terms of access to the visual maps. When I think about just websites in general, when they use images, which is so understandable why they would do that, it's hard to access some of those. Underpasses. Boulder has gone crazy in terms of developing underpasses, which really works well for us, especially in high traffic areas. So to the extent that Boulder can continue to do that, the city, and I know that some other cities in the county are not doing that as much because they're not as populated and it's not as busy, but wow, that makes a huge difference. It's much safer. I think I agree with Jamie that there does need to be a consistent emphasis on checking with people. Do these accommodations work? Or is it the latest fad that someone is selling? I was traveling on business and went to a hotel recently, and they did have all the rooms numbered, except that most of them had the wrong numbers on them. That was fun. So I think we have to really be sure that the disabled community is in the middle of the accommodations. And even though sometimes we don't use them very often, we need to be sure that the accommodations don't drop out of sight. So, for example, we have so many more options with beyond RTD, with Via and Lyft and Uber, and we could go on. And that's just tremendous. I think that there needs to be more emphasis on the outlying communities, and also just continuing emphasis on having those transportation options accessible in the evenings, on weekends, not just during limited hours.
Yeah, it's wonderful. So I just stopped sharing the panel screen because somebody said that they want to be able to see people when they talk. So thanks. So just to kind of summarize what we heard, it seems like enforcement of the ADA is lacking, perhaps like in different smaller communities that don't have the capacity to really enforce it. And then also I heard Judy talk about that digital accessibility, which is an afterthought for a lot of organizations. So really making sure that we have accessible naming of our graphics that we have on our websites. And there are tools where you can actually check the accessibility of your website, and I can send those out after this meeting. It also sounds like we have a lot of room for improvement more in like the rural areas. I liked how Eugenia said that there's not necessarily full access to employment or parks and recreation. So we really can think about those two areas. And then also just like acknowledging how far we've come. I think I heard Judy say that as well. And then Erin, you had said that really putting that human face to accessibility, so that it's not just looked at as, you know, some regulation that you have to comply with, you know, and just kind of, you know, something that when you're going through a process, you don't really realize like how much of an impact it's actually going to have. So those were all really wonderful answers. We're going to pivot a little bit to the COVID pandemic. So a lot of older adults and individuals with disabilities are considered to be vulnerable, especially vulnerable to this pandemic. And it's really forced local governments to focus more on online engagement, which is good to some degree, but there's also technology barriers that are associated with that. But from your perspectives, and I'm going to ask you, Eugenia, first, what barriers to accessibility has the COVID pandemic really posed?
I'm there. Thank you. I was trying to get the video to work. Yeah, I think that one of the biggest barriers have been isolation. That leads to depression too. For instance, the community that we serve, the people with intellectual and developmental disabilities, many of their services have been shut down because of the pandemic. They cannot receive them. So if you think about it, for adults who have a small group of friends, have a small, you know, a very small group of people to get a network to you know, to go around the community or just do daily living activities. So that has been shut down. And I know that is a you know, difficult times for everybody. It's for everybody, but the people with disabilities are isolated just almost by nature. You know, it's very easy to get isolated. And so I remember last week in one of these calls from Boulder County, we saw a graph that they were presenting about mental health in Boulder County and how many cases of suicidal attempt of the depression had been happening around in our community, and I just couldn't think, couldn't but think how many of these people are people with disabilities who cannot get out of the house, for many reasons. Maybe they have extra health issues. They have high risk. They have mobility issues. So that contributes to be isolated. I think that's one of the biggest issues that we face, and obviously that's going to affect our mental health.
Angel, you're muted.
Thank you. Next, we'll go to, thank you very much, Eugenia, for that. I want to thank you, even though I was on mute, thanking you. I really appreciate that discussion about isolation and mental health. Next, we'll go to Erin. So Erin, what barriers are you seeing to accessibility in the COVID pandemic?
One barrier that I've become aware of in talking to my colleagues about the barriers that they see is a communication barrier, especially for people that have low vision, because we're all required to wear masks, facial coverings. And if somebody can't see your face and read your lips, they can't understand, because they're hearing impaired. They can't understand your communication because your mask is obstructing their visual view of your lips. But there are some solutions to that we had just come upon. There's clear face masks that people can access because of that. But that's something that I never thought of in this day-to-day communication for people that have, either a visual impairment or a hearing impairment, or both. So that communication is a big thing for people, wearing the mask. And sure, people want to be protected and want to be secure in this time, and that's one of the biggest preventative measures that people have devised is wearing a facial covering, during this time. So that's something to think about and to be aware of, that not everybody can access the same information in the same way. Some people do. So communication in that one example.
Okay, wonderful. Thank you. So we'll move on to Judy. Judy, what barriers are you seeing to accessibility during the COVID pandemic?
There are probably three. One is definitely transportation, and it's really about, yes, RTD is cutting back, VIA is cutting back. I think both Lyft and Uber are beginning to ramp up. And I won't go through all the other options, but the availability of transportation has been a real challenge. And then the kind of add-on to that challenge is the safety. We blind people joke that we touch everything. So, it's a little more daunting to board a bus and not and try very hard not to touch anything, and also to keep a distance. And so that's been a second challenge. I think the third challenge is it's a mix. It's both a challenge and it's a silver lining, and that's the virtual piece. For example, our national convention of the National Federation of the Blind starts tomorrow, and for the first time ever, it's virtual. And what that means is that maybe twice as many, maybe 3 times as many, maybe higher, I don't know yet, people have registered to participate because it doesn't involve flying, hotel room, food, etc., which is always fun. Everyone likes that. Not flying during COVID, at least that's my opinion. But so it's a challenge in that a whole lot of people have to very quickly grasp the virtual tools. That's usually a good thing. And it's a gem in that the virtual tools that we have are opening up a lot more options than were there even 6 months ago.
Great, thank you. I'd be interested to see how many more people participate if you have like the raw numbers after you're done.
We'll get it. We'll get it because the registration hasn't closed and everybody's last minute. And if I were a betting person, I would say we will have at least 3 times as many, which means we'll go from 3,000 some to 9,000 some. But I don't know. We'll see.
Yeah, we've also noticed here on these meetings that we typically would have 25-ish people attend in person, and we've been up above like 45 each month. We are missing out on some of the quality of that interaction, but we're definitely reaching more people, which is a good thing.
Yeah.
So next we're gonna switch to Jamie. Jamie, what barriers are you seeing and experiencing to accessibility in the COVID era?
Well, I'd never thought going to the grocery store would be my greatest outlet for the week. Between grocery shopping and going to the bank, that's about it. And the frustration about it's the inconsistent application of the rules from our state government on wearing masks and social distancing. I think people would be a little more aggressive if they knew that when they went out, people were abiding by these rules, but we know that they're not. So that really puts our group, and I have I'm in 2 categories. 1, I'm over 60, and 2, I'm a person with a disability. So I'm in a really high risk area. But one thing I wanted to point out, and I'm not sure people have thought about this, there was some positive things that have come out besides the virtual, and that's the fact that there was some really great creativity as far as systems getting food to people. The Accessoride and the carriers that you have in Boulder that was starting to deliver the pharmacy stuff. RTD making sure that they had backup buses, so when the buses were full, people weren't standing out there. So there's some things I think we can implement maybe in our emergency plans, because I don't think those things are in their emergency plans. You get places like New Orleans or the East Coast that experiences hurricanes and on an annual basis, they probably have these things incorporated into their emergency plans. But I would like to see some of this creative things that were happening, like food delivery and pharmacy delivery and the changes that RTD made put into the emergency plans in our area. Thank you.
Yeah, that's great. Thank you all. So just to kind of summarize what we heard, like the isolation and mental health associated with social distancing can be really hard, in particular on communities with disabilities. Also, the way that we navigate the world, whether it be if you're hard of hearing and you need to read lips, or if you are low vision and you typically use more tactile communication and touching places to be able to make sure that you're steady as you're boarding a bus, like those have now been more challenging to do with either masks or just how the virus spreads. Also just talking about that creativity that is sparked by the force, like people having to be online and more virtual access. But then also, as Jamie had said, the creativity with the transportation providers, really getting people, bringing stuff to people has been a big move forward. I do want to say that I was on an accessible transit call with some national level transit providers, and they were talking about wearing masks for people with developmental disabilities or sensory disabilities and how challenging that can be as well. That didn't come up in our discussion, but I also wanted to acknowledge that some people with developmental disabilities, it was hard for the transit providers to help them understand why wearing a mask was important and keeping the mask on. And then also just wearing masks was forcing some people to kind of panic, I guess, with sensory limitations. So I wanted to bring up those two barriers as well. So we have about 15 minutes left, and we have one more question. And this one is hopefully our optimistic question. But basically it's, what role do you see the ADA playing in the next 30 years of our lives? So we're going to go ahead and start with Aaron on this one. So if you could unmute yourself and let us know, like, the optimistic vision of where you see us being in 30 years, additional 30 years because of the ADA.
Well, in the next 30 years, I hope that the ADA brings us a more inclusive society, and people are really aware that it benefits everyone in one way or another. You know, it creates diversity, you know, within the workplace. It creates assistive technologies for communication. It gives people the opportunity to access things that they never thought possible before. I mean, you know, somebody could need an automatic door opener, say on, you know, they'll be fine one day, and then, you know, accidents happen, you know, and the next day they'll need an automatic door, you know, and so I think to be included, and hopefully we'll see more of that. Hopefully we'll see more of an understanding. Just keep up the educational piece, and just to know how it's important to keep building on the progress that we're making, from the past to, you know, the current present situations, and really advocating for the future to make this law better in all aspects of daily life here in this country. Thanks.
Great, thank you, Aaron. So Judy, would you mind answering that question next?
Sure. You know, I think the sky's the limit. It just seems to me that it's going to grow a lot faster over the next number of years, in large part because I think technology is going to get more and more affordable and more realistic for everyone's lives. And so it makes it a little easier to streamline things for us. I can imagine, for example, autonomous cars. I'm pretty excited about that. And I certainly intend to be in one just as soon as they're available. Autonomous drones for humans, that I'm a little more hesitant about, but you never know. I think that, these are worldwide developments that will affect everyone. I think the same can be said for much smaller, more basic things. For example, for people who are blind or visually impaired, ways to read labels, labels on products. That's become so much easier now. To read signs, for GPS access, to be able to get around. We were talking just this morning about the fact that blind people can use applications on their phones, on our phones, GPS apps to get from place to place. The challenge is we have our phone in one hand and our cane in the other, and we don't have a hand for our coffee. So we're going to have to figure out how to make that work. But I think a lot of things are coming that we can't even really imagine. That's my sense. I'm really excited about it.
Great, thank you. So next, Jamie, do you want to talk about what role you see the ADA playing in the next 30 years of our lives?
Well, my vision is that people in 30 years, or hopefully sooner, will look at the ADA as a benefit to everybody, not just for those disabled people. The fastest growing population that we have are people turning 80 years old. And obviously that usually comes with mobility issues. So, I dare to envision that, half of our housing inventory would be accessible in 30 years. That land use policies would help develop communities where most amenities would be within 1 mile. And a labor force, filled with people with disabilities because their skills are recognized and needed. And then transportation that provides stops where the population needs it the most, and as our low income and middle class neighborhoods. And one of the big things that we've been working on lately is trying to get on-demand service for people with disabilities. One of the things are lacking is that the elderly and people with disabilities, if they're using paratransit type of vehicles, have to wait at a minimum 1 day. Some services, you have to wait 3 to 4 days for an appointment. So we're hoping that maybe, utilizing outside resources like Uber and Lyft and other professionals, one day we'll get to a point where somebody can pick up the phone and get transportation within a reasonable time. Thank you.
Great. And lastly, Eugenia, how do you see the ADA impacting our lives over the next 30 years?
Oops. Sorry, having trouble with my video. I think it's very important. I think that I just just like the rest of the panel mentioned it. It's just like I think the same way they think. It's very important to continue to implement the ADA and keep looking at it. Continue with the education about the law for people with and without disabilities, because the reality is, like Jamie said, that it's accessible. Having a community that is accessible is for everybody. It's not just for people with disabilities. But there's one thing that Judy said that I feel the same way. I'm very excited about technology. We have seen what it can do. Most at this time of the pandemic, we have access to many things, and I'm excited for young people because it can open a tremendous door for employment as well, and also for improvement of these technologies today. As they say, nothing about us without us. So people with disabilities can make a huge contribution to technologies, ideas for implementation, coming up with new ideas, just like Jamie was saying too about that creativity. And so I think the opportunity is very big, and I'm excited for that, for what is out there, the opportunities that would come in the time, and also for the young people, and what kind of access, not just to physical access, but again, access to employment, access to opportunities to have a fulfilled life. That's what we all want to have, right?
Yeah.
Great, thank you, Eugenia. So just to, it seemed like a couple of those items are kind of low-hanging fruit, right? Things that we can actually do, like educate people on like how the ADA impacts everybody, and then also how it allows people to be an like inclusive, instrumental part of society. Some of the things like technology, we really need to consciously be at the table, it seems like, to make sure that the technology is going to be accessible. But the biggest theme that I heard in that was just technology, really. I mean, that on-demand quality of life service. So like Uber and Lyft, hopefully at some point, they'll have more accessible vehicles so that they are accessible to people in mobility devices. But just in general, I think that moving, like technology moving forward. And then also I see in the comments here, getting access to technology and training on how to use the technology is a real challenge. So just because we're moving forward with a lot of technological advances, it doesn't mean that it's accessible to everybody, right? So we really need to look at that. We have about 8 minutes left, so I want to open it up to the panelists to see if you have any last minute things that you would like to mention to this group. Oh, I see Debbie. Debbie, you have a comment you want to make?
I think one thing for me that I have seen, sorry, my granddaughter's in here watching a movie, I had muted, sorry. One of the things that I have found, and this just happened again last week, is that I am my best advocate. And while I wish I didn't have to be, I am often. And when I go into a business that is not finding ways to adapt to my disability, I quickly ask to talk to the manager in a very kind way. I laugh, I joke, and I explain the situation rather than get really defensive and angry of you're not meeting my needs. And I find that when I do that, people have been so kind and so helpful. For example, there was a restaurant downtown that did not have an accessible, they thought they were accessible, but my wheelchair could not fit in their bathroom to get into the stall. And so the owner stood outside the men's room, and while I went in the men's room, which had more space because smaller urinals rather than the openings, and kept me, allowed me to have my privacy while I did that. And it became a joke. We laughed about my first time in the men's room and things like that. Recently, I went to get my eyes checked. And when I went in, I had called ahead of time because I was very concerned from the COVID-19 perspective of what my treatment was going to be like from a healthcare perspective. And I was assured they were all going to be wearing masks. They were all going to be gloved. They were all going to have everything clean. They would take temperature of everybody when they came in. However, when I went in, there was a gentleman in front of me, a senior gentleman, then me, and then a mom and 2 children behind me. The only person whose temperature they took was mine, and these were walking people. So I found that like it was one of those odd things where, do I really want to complain about this? They're doing right by me, but how insulting, because they're really not. If they're thinking I look like the sickly person because I'm sitting there in my wheelchair versus these other 2 people who could just as easily be COVID carriers with temperatures as well. And so I came home, and a week later, it was still one of those things that I just didn't like that happened. And so I wrote them a very kind letter, named the people that were great in their business, that really helped me. But then I also pointed out that don't just assume because someone's in a wheelchair, they're the sickly person that needs a temperature taken. If the procedure is we all get our temperature taken, then we all get our temperature taken. So again, it's just an example of ways where I became my own best advocate.
Yeah, great. Thank you, Debbie. Do we have any other comments that we want to make before we wrap up the panel discussion?
This is Jamie. I would say in a perfect world, it would really be nice to see some kind of curriculum in our high schools teaching disabled and non-disabled, mostly important the non-disabled kids, on why the ADA exists so we can get some more empathy and understanding. I think just like any other movement, it should get the credit it deserves in our high school curriculum.
Yeah, that's a good point. Yeah, wonderful.
This is Eugenia, Angel.
Yes.
I just wanted to say thank you for inviting us today here. It has been a great a great conversation about ADA.
Well, thank you for agreeing to be on the panel. I was really excited. If any of your organizations are hosting any 30th anniversary of the ADA events or have any content you want me to share, please send it to me. I know that a lot of the national level ADA organizations are celebrating all year long, so not just in the month of July. So just keeping that in mind, that it is never too late to be able to host your own ADA panel or to get the word out. It will help us really educate everybody involved and like how impactful the ADA has been and how much more room we have to go. So, okay, wonderful. Thank you so much. And I really want to thank my panelists here. I know that you all have busy lives doing all sorts of wonderful advocacy and wonderful work, and I really appreciate your perspectives. You made this more impactful than what the LCC could have done on its own. So just thank you so much for your time and for being open and vulnerable, for sharing your perspectives on this. And I just really appreciate all of you for taking part in this. So thank you. Round of applause. I know that we can't get that feedback, but Judy, Jamie, Eugenia, and Aaron, I really appreciate your time and your perspectives. So thank you. So we're going to go ahead and move on to the next portion of the LCC. So I hope that some of you can stick around because we have some important updates that we'd like to share. But if you have to jump off, I understand. So can people see my screen? Thumbs up if you can see my screen. Okay, great. So the first update that we'll do for the LCC, I'm going to ask Aiden to unmute himself and talk a little bit about the tech workshops that we're doing.
As Angel mentioned, we're starting to do our tech workshops for the public. We held our first public workshop all online last week, and that went very well. We're holding a total of 4 different workshops covering 5 different apps. So we do one on transportation, so that's the transit app along with the RTD mobile ticketing, and we'll be holding one of those tomorrow morning at 10:30. And then we also do one for Lyft, one for Uber, and one for Google Maps as well. The classes tend to run right around 2 hours, and then we hold a follow-up session on Mondays where we have an office hour. So if anyone has any further questions about the technology and about the apps, we can be there to help answer that. Trying to, again, help provide some of that support that's lacking in that virtual setting. So making sure that we're circling back around to try to catch people who may have had some issues arise since first trying to use the apps. As I mentioned, there'll be one tomorrow morning. And those all...
Aiden, it's actually, sorry to interrupt, it's actually Wednesday. Sorry.
Oh, my
We're
bad.
still on
Wednesday
Monday.
morning.
Yeah. It'll be Wednesday morning at noon, or Wednesday at noon.
My bad on that one, Wednesday morning. And then there's additional information on them both in the LCC newsletter as well as in the Mobility for All newsletter.
Great, thank you. And also in conjunction with these, I just want to say that Anna, another one of our outreach and engagement specialists, is creating videos so that people can learn how to download the video or the apps before the sessions. Because typically, like when we would do these workshops in person, we would help people download them and it would be an all-inclusive, but it's kind of hard to have that back and forth. So I just wanted to thank Anna for creating those videos for that as well. And then I'm going to hand it over to Anna next. So Anna, if you want to give us an update on the Ride Free Lafayette.
Yeah, so Ride Free Lafayette is going to be launching later this month. It's going to be an on-demand transportation service that's fare-free for those in that city. And then it's going to run from 7 a.m. to 8 p.m. every day, including holidays. And then you have 3 ways to book a ride. The first one is using the app called On Demand Transit. You can also visit the web page Ride Free Lafayette or talk to someone in person, not in person, through a phone call using that number on the screen.
Thank you. And you'll find that this URL isn't active yet, but it will be active soon, and we're really excited. We have over 100 organizations in Lafayette that we're going to be distributing flyers to. So we're partnering with Commuting Solutions, which is basically going to be doing the outreach for us for the first 4 months. And then Via Mobility Services is actually providing the trip. Is the contractor that we're using to provide the service. So this is a wonderful expansion of transportation options in East Boulder County, and we're really looking forward to it. So next, I'm just going to talk a little bit about how there's some grant funding options that we've been coordinating on by Via Mobility Services and Ego Car Share. So 2 that I want to point out to you is it's due at the end of this week. Boulder County is applying for year 2 of the Ride-Free Lafayette service, and this is a funding source with DRCOG. We're hoping that we'll get year 2 to continue it because it takes about 2 years for a new transit service to have an impact. And then also as part of that application, we're also going to be requesting a feasibility study to see if it's feasible to have an RTD Access-Ride certification center in Boulder County. So this is building on that discussion that we had with Paul Hamilton at the beginning of the year with the LCC, just talking about the long trips to go to Lakewood to get certified for Access-Ride. So we're just going to see if we get the award and see if we can figure out what it would cost, what are the implications of being able to have a second ADA certification center here, Access-Ride. And then one other project that Via Mobility Services, Ego Car Share, and Mobility for All are partnering on is a Next 50 Initiative grant application, and we're looking at it being possibly a new vehicle for Via's volunteer driver program, 1 or 2 new vehicles for Ego Car Share to see if we can expand to low-income housing sites. We're looking at Golden West and potentially Kestrel and Louisville to see if we can get a EV car share in East Boulder County. And then Mobility for All, the portion of our project is that tech education for those platforms. So we would basically expand the technology education to include reserving an Ego Car Share car or something along those lines. So we are meeting this week to flesh out this grant application a little bit more, but we would like to see if any of you are interested in providing a letter of support for the Next 50 Initiative grant. So if your organization is interested in providing us a letter of support to have a vehicle at Kestrel in Louisville or at Golden West, then please reach out and let us know. And it says, Lindsay said that she'd love to discuss this application offline. So yeah, it'd be wonderful. And then Zoe says, yes, we need letters of support. So I think that what we'll do is we'll finalize that letter of support. It's going to be kind of a quick turnaround because the grant application's due in July. But we'll we will send you a letter, basically like a template for you to fill out. Zoe, do you want to unmute yourself and say anything else about the grant application for the Next 50 Initiative?
Certainly. Yes, VIA is very excited to partner with Mobility for All and Ego Car Share on this. It is really pertinent that we get lots of support from the community, from folks who can say that, yes, having a VIA volunteer driver or a car share vehicle or combination thereof would really make a difference in my life or in my community. I do have a template ready, so I'm going to share that with Angel today. So please do let Angel know if you're interested. I will also put my email address in as well, but we're really hoping to leverage the strengths and resources of all of our organizations together to really provide a greater level of accessibility to transportation options. Thank you.
Thank you. And one of the considerations in the Ego Car Share location was basically the transportation gaps that we've been trying to address in East Boulder County for a while. And there needs to be a certain level of density of housing around where they put the Ego Car Share vehicles. So if it were located at Kestrel, that would also be accessible by Ride-Free Lafayette. So it would mean that the car share service would be accessible to Lafayette and Louisville residents. So that was kind of our thought process on that. So next, Zoe, I'm going to call you back on. There was a very important announcement that Lindsay asked me to put out in the newsletter, and I forgot to include it. So I'm sorry, Lindsay, but we're going to have Zoe give an update on a really significant change in transportation in the Denver metro region.
Thanks, Angel. All right, VIA is very excited to announce that starting July 1st, SRC, Seniors Resources Center, has transferred their transportation program to VIA. That means that we are taking over the paratransit aspect down in their service area. And I'm going to go ahead and just drop our press release. I just put a link to our official press release that describes the change into the chat box there. So please check that out. One thing to be aware of during this time, we're not able to accept new clients while we're getting all of our new services ready, all of our ducks in a row, but we will have more information about that coming this fall, where we're hoping to expand by that point.
So, oh, go ahead.
Oh no, go ahead, Angel.
Oh no, I was going to let you wrap up. But.
Thank you. Yes. I'm actually, what questions do you have?
So I do want to say that this is kind of bittersweet news, because those of you who know Hank Broxma, he was the director of transportation, and he's been pretty, he's been a permanent fixture on all of the regional transportation coordination issues. But I'm just so happy that VIA was able to step up, because the people who were with Senior Resource Center, if they stopped their transportation programming without a replacement, that would have hit a lot of people really hard. And also Lindsay wanted to note that Hank is working with VIA through at least October to help with that continuity. And I do want to say that this has, I know that there's going to be a lot of changes, but this has potential positive impacts on overcoming those geographic barriers that people sometimes experience, right? So with VIA Mobility Services clients not being able to cross over into Denver or anything like that. So by VIA stepping up to take over SRC's transportation services, there is huge implications for regional mobility. And so I'm really happy and looking forward to the potential benefit. So any other questions for Zoe? Okay. Okay. So what are the new boundaries? Carrie wants to know. Zoe?
I wish I had that exact information. I apologize. I don't have that. I know that it's going to be in the Denver metro area. Super helpful. Lindsay, do you have that information by any chance?
Yeah, I don't have the exact info yet either, but basically right now, nothing is really changing for the SRC clients. They're still calling the same number. The biggest change they're going to notice is that their drivers that they're used to are going to be driving VIA branded vehicles and wearing VIA uniforms, and they're going to meet some of our drivers, because we're hoping to chip away at the denials that they've been experiencing. So whatever the service areas were, they're going to continue to be the same for now. And as Angel was saying, we very much are looking forward to changing it up and making it so eventually folks will be able to travel between those two areas. But until we work out the kinks, figure out some of the, like some funding things and just get a feel for the service itself, we'll kind of keep it the same through the summer and start to make some changes in the fall.
So Maura Moon says that Clear Creek County will be operating their own service. So previously, SRC, they operated in Jeffco, and they went up to Evergreen. And then also they were operating in Denver County, City and County, and then also Arapahoe. I think that those were the three counties. And then VIA will be taking over the Evergreen Jeffco areas. So that's good. Thank you. Maura, I don't know if you want to hop in because from a CDOT perspective, I know that you all played a very instrumental role in ensuring that people just weren't abandoned, like when this happened, and that there was a continuity plan. So I don't know if you want to unmute yourself and say anything.
Hi, sure, Angel. Hi, this is Maura Moon from CDOT. Yeah, it's been a great transition. Again, as you said, bittersweet. It's been really excellent to work with SRC over these years. Really grateful for the folks at VIA to step in. I suppose the only thing I was trying to add here was that a major difference is that Clear Creek County has decided to become a subrecipient of CDOT and apply for admin operating funds to run their own service in the Clear Creek County area. But VIA has, for those two rural areas that SRC would serve, in addition to the Denver metro area, VIA is going to take over the Evergreen, Jefferson County area. So just in response to the question about the boundaries. So yeah, thank you, Angel.
Thank you. I appreciate it. So do we have any other questions about the SRC VIA transition? Okay. So if you have any questions, I'm sure that Lindsay and Zoe would love to answer your questions on that. We're going to transition over to Key Transit. Corey, if you are on the line, can you go ahead and unmute yourself?
Good afternoon, everybody.
Afternoon.
So I'm Corey with Key Transit. We're locally owned and operated wheelchair transportation company. We've been working in the Denver metro area for 7 years now. We've seen substantial growth. We take one guest, as we like to refer to our clients, at a time. And it is a door-through-door service, ADA accessible entrance, obviously being required to assist someone in and out of their home. We're catering to over 100 skilled nursing communities, assisted living centers, independent living communities in the Denver metro area, and we're just starting to expand into the Boulder area. So last year we successfully and safely transported over 20,000 participants or guests, and we also are working with PACE programs and in the process of contracting with TruePace in Boulder. So just wanted to put ourselves out there and to let you know that there is another resource available. Taking one guest at a time, we will accommodate a caregiver and or a family member along on the ride, and we are following all CDC guidelines in terms of disinfecting vehicle in between each and every transport, taking driver's temperatures prior to every shift. So I'm just glad to be welcome to this network, and if you have any questions, I'd certainly be happy to address those.
So I have a question, Corey. So you contract directly with the senior living facilities to provide the transportation, correct?
Correct.
Okay. Okay, great. So thank you for that. And you said that you're expanding to Boulder. Is that Boulder City or Boulder County?
Boulder County. And we have visions of also expanding into Colorado Springs in the future. However, we don't really have any contacts there at the moment. COVID has made it extremely difficult to reach out and develop those new relationships. But yeah, we are licensed to serve anywhere in the state, so we'll go wherever we're needed, and we do offer same-day availability. However, those really long-distance trips, like we do occasionally go to Grand Junction and so forth, usually require a couple days' notice.
Okay. Okay, great. So if you have any questions for Corey, please put them in the chat box here. Welcome to Boulder County, and thanks for improving mobility for people.
Happy to help.
Great. So next, I wanted to just, we have a couple minutes. Does anybody else have any other transportation updates they want to make, or any barriers to transportation that their clients are experiencing at this point? So is there other funding source for Key Transit? Can you explain that, Jan? So you're asking if it has to be private pay transit, or if they have like some sort of funding stream that you can tap into? Is that what the question is?
Yeah, because you just clarified that they contract directly with the facilities. I just wondered if there's any other option for some kind of funding source or payment for other people to be able to access that service.
That's a good question, and thank you for bringing it up. The majority of the facilities in which we serve pay for us to transport their residents to and from doctor's appointments, dialysis, and so forth. We do have a fair number of private pay clients, and during this pandemic, we are going to offer a voucher code where we're offering 50% off of our services. It's something that I'd like to coordinate, if I may, with you, Angel. Perhaps we can discuss that after the meeting, but we unfortunately, we're not a nonprofit organization, so we don't really have any other way to cover our operational expenses.
Okay. So I guess I have two questions to follow up with that. How do you, what is your funding schedule? And also, do you transport potentially COVID positive patients?
We are not currently transporting COVID positive patients, but we are in the process of at least exploring a COVID task force. There's going to be a lot of work behind the scenes before we can actually pull the trigger on that to make sure we can do so safely. And I'm sorry, your previous question?
What is your funding schedule? So how do you calculate how much the trip's going to cost?
We have a base rate of $46, and then we charge per mile at $4.75 per mile. Some people find it cost prohibitive. Other people, find it to be competitive, if not maybe even a little less than some of the people that are offering similar services.
Okay, great, thank you. And if you could send me an email with that cost schedule, like your cost breakdown and just some, maybe a flyer, I could share it with the group as well.
Yes, I'd be happy to.
Great, thank you.
Uh-huh.
Okay, so do we have any other questions before we move on? So I'm going to go ahead and move on to Dr. Mack. Allie, I don't know if you're on the call or not.
I am, hello.
Hi, so we have about, I'm sorry to cut you short, but we have about 13 minutes. Do you think that that's going to be enough time?
Absolutely. I'll just go a little fast, but we should be totally fine.
Great, and I will stop sharing my screen.
All right, and I will start sharing mine. Okay, so hello everybody. My name is Allie Mercer and I'm with Dr. Mack. And I'm just going to give a quick presentation about an app that Dr. Mack has recently launched. So it is called Getting There. And what it is it is a paratransit-based app that includes many services. Sorry, I'm trying to figure out access on my computer. Okay, let's see if this works. Okay, is everybody seeing my screen okay?
Yeah, we can see your screen. I don't know if you want to put it in presentation mode. That might help fix.
There we go.
Okay.
Right, so again, yes. So we have launched an app called Getting There. And basically what it is if any of you have ever used one of our Getting There guides, it is a resource that includes information about pretty much any and all transportation in the Denver metro area. So basically what we've done is we've taken that, which is a 12-page physical guide, and turned it into a digital guide that you can access from your phone. So Getting There includes information about public transportation, so like RTD services, volunteer-based driving services, and private options. So this is the 9-county area that this app serves, including Boulder County, obviously, but it also serves all of the 8 surrounding counties in the metro area. And this is what the icon will look like. So if you go into the App Store for Google Play or Apple, you can find it, and that's what it will look like right there. So we specifically designed this app to be more accessibility friendly, since it does focus more on paratransit and accessible transportation modes. So we carefully crafted it in contrasting colors. We used mostly dark blues, blacks, and whites, and made the font slightly bigger just to make sure that it was easy to see for anybody who wanted to use it. And we are currently working on getting it certified by a third party as a fully accessible app following the ADA's guidelines on technology. And so I'm just going to take you through what it looks like to use this app. It doesn't take long, and we tried to make the process as intuitive as possible. So when you open the app, all you have to do is enter what county you're in. And if you don't know what county you're in, that's fine. It has a geolocation feature that will detect your location and then enter the county automatically. And then you just need to enter the address of where you would like to go. So there are additional questions that you can answer after this step, but they are not required. Those questions would be like, are you a veteran? How old are you? And so on and so forth, just to make sure that we can narrow down the options to ones that would be the most viable for you. Again, it is optional, but we believe that it really does help with the results because we do use a filtering system. So if you don't answer those questions, it will just provide you with any applicable service, and some of those might not serve specific age groups. For example, a lot of our services are exclusively for those 60 and over. So if you don't answer how old you are and then you go through the results, it might give you some that you cannot actually use. So I do recommend answering the questions, but again, not absolutely necessary, just helps streamline. So there are some symbols on the app just to make it easier to kind of decipher the results. We didn't want to use a lot of words. We wanted to make it very clear. So we have this symbol, which obviously means this vehicle or service is completely wheelchair accessible. If it has a little bus next to it in the results page, that just means that it is public transportation or a fixed route service such as RTD. There is the phone icon, which just means that you should schedule this ride in advance. And when you click on the result, it will tell you how long you need to schedule the ride in advance. For example, like 3 to 5 days, or if it's a service like Key Transit, it can be a same day. And then if it has a $sign, that just means that it will cost money, since some of the services are free or very low cost. And this is what the results page will look like. So each result matches what you need based on your locations and your answers to the questions on the homepage. So this is what the results will show up as. And if you were to click the more info icon, it will drop down to this menu and it will show you all of the details that you would need to know about getting a ride with this particular company. So it will show you from and to what counties that it serves, as well as whether it is volunteer-based or how much it costs. It has the hours of service, again, the advanced time to schedule, and then additional info. I used American Cancer Society Road to Recovery for this as an example because it does only serve cancer patients. So things like that would be in the additional info section. And we do include these 2 buttons right here, which are direct links to their phone number and website. So the app does not provide you with the scheduling for any of the services, but it does provide you a direct link to contact them to schedule the ride. And that's all it takes. Again, like I said, we weren't looking for it to be complicated. We were looking for it to be pretty intuitive and easy to use, but we are always looking for feedback on the way that the app is working. We are constantly updating it and working out kinks. So if you download this app, which again is available on both Android and iPhone, we would love to hear any questions or comments that you have. And I will put my email address. Oh, thank you, Zoe, in the chat. I see you said it's very helpful. Wonderful. That's what our goal was. So yes, that's pretty much it. Thank you for allowing me the time, Angel. And I hope everyone gives the app a download and kind of tests it out.
Great, thank you. So do we have any questions for Allie before we move on? I just want to say that this is a really big advancement. Let me go ahead and, okay. I just want to say that this is a really big advancement because I know that we've been talking about like how to do a search of Dr. Mack for quite a while because it's a wonderful, that's kind of Dr. Mack's claim to fame is that they do the Getting There guide that we just can't keep enough of. People just really love it because it not only covers Boulder County, it covers all of the counties in the metro area. So this is really a huge step forward for having a little bit more searchable transportation database. So any questions for Allie before we move on to RTD?
I have one, Angel. This is Jen. I was wondering where we can find the application.
So it is available in both Android and Apple app stores. All you have to do is search Getting There, and it should be the first results.
Wonderful, thank you.
Absolutely.
Great.
And I do see another question about the app's languages. Right now it is only available in English, but we are actively working on a translation service that would allow it to be visible in any language.
Great, thank you. Because I know that the Getting There guide is in 5 different languages, correct me if I'm wrong? Yeah, so I know that you all are very culturally competent when it comes to accessible information in various languages. That's great. Okay, so I'm going to go ahead and we have 2 presentations today for RTD. So we have Christina, who is their Community Engagement Manager. She's going to be talking about service changes since COVID-19. And then we have Bill Soroy on the call as well, who's going to be focusing on their Reimagine RTD process. So these are both really important information sources for our call today. So I'll go ahead and stop sharing. And Christina, if you want to go ahead and share your screen, let me know if that's good. If not, I can pull up the presentation that you sent me.
Sure, I'll go ahead and share it. I believe. Okay, is everyone seeing it okay?
Yeah, thank you so much.
Perfect. Hi, everybody. I'm Christina Zazweta with RTD Community Engagement. This afternoon, I'm going to go through some of the general items that RTD has done as far as our actions during COVID-19 and some of the things that we're seeing as a result of COVID-19. And then I'll hand it off to my colleague, Bill Soroy, who's going to be speaking about Reimagine RTD and what we're looking at as we move through COVID and some of the future items that are upcoming for us. So we get a lot of questions about what we have been doing, and I think the most important thing we need to stress is just that we're cleaning our vehicles each and every night. We have the equipment. We've gone out and gotten the electrostatic cleaners, and we're going through our buses and our trains and making sure that they're consistently cleaned. We did implement during COVID and during the height of COVID some rear door boarding. So we suspended the fares and boarding was being accomplished through the rear doors. And now we have started to go into collecting fares again as of July 1st, which means that we are now back at boarding in the front of the vehicles. And throughout this process, we are installing clear plexiglass covers on our buses for our operators just to provide an additional barrier between themselves and the customers and to keep everyone safe. We did during this time also see a decline in ridership, about 75% or just a little bit over that during the height of all the closures when all the businesses and everything else was closed. And even as such, we wanted to make sure that we were encouraging social distancing. So we were limiting the amount of riders to our vehicles, 15 for the standard size buses, 20 for the larger buses, and 30 for the rail cars. And in order to accomplish this, we are staging additional buses along the routes. So if an operator notices that their bus looks like it's getting full beyond those capacities that I mentioned, they are able to call dispatch and request an additional vehicle come in and join the route so that they can pick up the additional passengers. Likewise, we have street supervisors constantly monitoring. And as ridership ebbs and flows, which is what we're also seeing from week to week or day to day, we are making sure that those buses are being plugged in where we can. We do get a lot of questions around masks and how we're enforcing it. We are asking everyone to wear masks. Our operators are required to wear masks as they operate our vehicles. And we are seeing for a good part that most people are wearing masks. You do get occasionally that people don't wear them for a variety of different reasons. Our transit police are out there to encourage people, strongly request for them to wear them. And that's all part of our customer code of conduct that we've implemented to ensure that everybody's safe and not only for themselves, for everyone around them. We've installed a signage to also encourage this, and there is onboard messaging, audio messaging as you ride, which we're changing along the whole route of what we're doing. So when we had the fares come back in, we had onboard messaging letting everyone know that the fares were going to be implemented once again, and now we have the very same overhead announcements in our vehicles reminding people to wear their masks for everyone's safety. And so here I have some of the signage that you'll see on some of our vehicles. Again, passengers are required to wear the masks. We also ask that people don't board the vehicle if it appears to be too full. So this is part of our Partners in Safety program. We realize that even though we could push out all the messaging that we would like people to do certain things, it really does come as a partnership between us and our riders. And we can't do it without every person's compliance with all of this. We can't do this alone. And if we are going to do something to make people feel safe, it really comes down to everyone's individual responsibility to help us out. So again, if a vehicle looks very full and you're not comfortable with the amount of people that are on that vehicle, there's a couple of things that you can do. You can definitely see whether or not it looks full and don't board it. Wait for another one. There will be another vehicle coming because we do have those supplemental services. We ask people to use their judgment when they see that. There are some apps that you might see out there, like the Transit app, which is a third-party app. We don't have it, but some of them are looking and monitoring some of the passenger loads based on cell phone data, et cetera. So that might be something that you can explore if you're interested in knowing, hey, what does my bus capacity look like today? And we have been out at a lot of stations. As I mentioned, I personally have seen that most people are wearing masks and doing their part as we go out there in the community. But we have also gone out and given out some masks at our stations, given out some hand sanitizer, talked to both our riders and both our operators, and just checked in with them to see how they're feeling about everything as we move forward. There's a lot of people that did mention that this has been very important for them during COVID. Even if everything seemed to be closed, there were some essential trips that they still needed to have, and they were grateful for RTD to continue service during that time. However, you know, as I mentioned, they for the most part see most people wearing masks, occasional outliers, but these masks that we provide are just an extra way to remind folks that we are all in this together. Okay, so as part of COVID, we RTD did receive $232 million through the Government CARES Act, and those are all 100% federal funds. There's no local match required for that. One way that the way we are supposed to be using this is these are reimbursement funds. So it's nothing that we could use for other services except for those related to COVID-19 response. So that would have been anything for personal protective equipment for our operators, primarily in our first line of employees. the cleaning supplies that we brought in addition to the ones we had been using previously, just to make sure that we had the right ones to respond to the COVID virus specifically, and to the salaries that go into the operating costs as we add in the additional bus services. A lot of people ask whether or not we are now having less service out there because we aren't seeing the ridership, but in fact, we're still operating a significant amount of our services. So as we move forward, there are still continued financial challenges. Even with the CARES Act, there's still some challenges that we need to solve as far as finances go. And so the suspension of fares and the reduction of sales and use tax during the closures has compounded the financial issues that we had seen even before COVID. We are cutting costs, we're streamlining projects, we're streamlining our processes, and we're looking at our positions to see how we could best gear the agency for these challenges that we're seeing. There are furloughs in place for the salaried employees. So those are folks that are not our operators. Our operators are represented. So currently the furloughs are only for salaried employees. And really within the next 2 months, it will be very telling for us. It'll be important in determining our financial future. We're seeing this as it's rolling in and looking at it and seeing how we're going to move forward. And so with that, I'm going to pass it over to Bill Soroy here, who's going to talk a little bit about the future of RTD and what we're looking at as we look at these challenges and the future and beyond. Bill, you with us?
Yeah, thanks, Christina. And hopefully you'll be able to advance my slides since I know you already have it up. So thanks. And this dovetails really well with what Christina was talking about, because obviously we're talking about COVID and the impacts that we're seeing on the ground. And now I want to talk a little bit about RTD's Reimagine process, which is really looking at the future, but we are feeling the impacts of COVID, and in particular on the process that we're in right now with our system optimization plan, which I'll get to. We are seeing some major impacts that I'll talk about. Next slide, please. So just going to give you a little bit of overview of Reimagine today, get some of your feedback, and actually talk to you about an online survey that we have in place that I'll direct you to get some more specific feedback to us. And I'll talk a little bit about engagement and outreach, and then open it up to questions. Next slide, please. Next slide. So what is Reimagine? It is really a data-driven process. I mean, and we are looking, to do a very robust engagement. Obviously, we've been impacted by COVID in terms of how we do that, and have to do more things like this in terms of the virtual meetings. But we really are, wanting to have a broad level of input by a variety of people. We really look at this as a way, how is RTD going to evolve, kind of both in the short and long term, and this is really an important part of the process. Go next slide. So what is Reimagine? There are two primary deliverables as part of the process. One is a system optimization plan, which is really focusing on how we provide service with our limited resources. And this is going to be initially a phased implementation, with the initial implementation in the January 2021 Run Board. So it really has some very immediate impacts. And then it'll look longer in terms of how do we reorient. Those are familiar in the transit industry, transit system redesign is another term for this. A lot of other agencies around the country are doing, really taking a hard look at their services and their routes, and trying to come up with a more efficient or effective way to do that. And that's what we're doing right now. The longer term piece, the mobility plan for the future, which we're really going to start up more in earnest this fall, is really looking at what's going to be our long-term future between now and 2050, really to what is our role in addressing the future mobility of the region. Next slide, please. So what are our challenges in Reimagine associated with COVID? So obviously, you heard Christina talk a lot about it, but as with Reimagine, we're trying to figure out how do we look at service and what level of service can we assume as we move forward. So we've had to really kind of respond to our financial situation, and we're continuing to respond to it. Obviously, we have a fairly dramatic cut in service right now that was implemented in April. We're looking at that and working with our finance department in terms of looking at our future forecasts for next year. But what I'll say is that next year, really, we do have a real challenge because we aren't expecting any CARES money Christina talked a little bit about that. So we got $232 million this year, but next year we're not expecting anything. Now it would be great if we got something, but so that is going to be a major impact on us and a major impact on how we can provide service. So we'll be looking at that over the course of the next few months and really use this as we look into our long-term future. But it really will be important for folks to stay engaged as we kind of proceed with the development of a system optimization plan in the fall. Next slide, please. So some of the key elements here, again, focusing on evaluating our current system and what we can afford, looking at how we can, getting input on priorities. And this is really where we want your input and what the online survey is intended to do, is look at what should be RTD's priorities in providing service. What are some of the key elements that you think we should continue to provide? Because we have scarce resources and we might not be able to provide everything everybody wants. In fact, I can probably pretty much guarantee it, because we are going to continue a reduced level of service for a while. And then, like I said, we're going to be implementing the system optimization plan in January, and then focusing on the mobility plan for the future, which will end up in next summer. Next slide, please. So we kind of started this process with a pretty simple question: is what does success look like? And we have two major committees that we've engaged in this process. We have an advisory committee, which is more of a policy level committee made up of elected officials and other kind of senior folks around the region. And then we have a technical working group, is mainly staff and from key local jurisdictions and organizations throughout the metro area. So utilizing them and input from our board, here's some ideas for how we could look at success: frequent service, partnerships, looking at high ridership, and really utilize this as kind of a basis for how we set the stage for creating a system optimization plan. Next slide. So utilizing that input, we developed some scenarios in terms of trying to understand kind of what are the trade-offs associated with service in terms of areas that we can emphasize. Obviously, emphasizing a social equity piece in terms of those who need transit the most, trying to orient service in that kind of particular theme, versus something where geographic coverage, where we're trying to spread it out to as many parts of the region as we can. And then things like service quality, which is really about fast, frequent service, and then cost efficiency, which is really more about the best bang for your buck or the most cost-efficient service. So we're in a process right now looking at these four scenarios to look at the true trade-offs. And the intent is not to come out, pick one of these scenarios, but really pick elements of these scenarios that people can have gravitated to, because there are trade-offs and we won't be able to be everything to everybody, especially in light of the COVID situation. Next slide, please. So one of the major pieces that we have from an engagement standpoint right now is an online survey, which this provides that link, and we can provide an additional link, which we have an accessible, ADA accessible version as well, English and Spanish online. So we encourage you to go and fill it out. It's a pretty simple survey, but it really will provide some good input to us as we move forward and look at priorities for service from 2021 and beyond. Next slide, please. So a little bit about engagement, again, building on the survey that we've been doing. Next slide. We've kind of have three phases of it. The ongoing piece that we started from the beginning, which is really just an education about Reimagine processes at RTD, versus now where we're talking about priorities for potential scenarios and trade-offs. And so this is a really key piece. And then this will kind of lead us into later in the summer and the fall, when we're going to develop a system optimization plan, which will be, like I said, the initial phase of that will be focused on a January 2020 run board change. And we'll be looking to have specific routes, frequencies, and other types of services. And again, want to reiterate that the impacts of COVID means that this will be an ongoing challenge for us, and that the January 2021 run board, we expect to have a sustained level of cuts similar to what we have right now with the COVID situation. Next slide, please. So our next steps, like I said, we have this survey out today. That's the informal survey. It's on our website. We also have a statistically valid community survey, which is being done by one of our consultants that we're going to, again, to use kind of developing some critical information about priorities from folks around the region. And then we're going to use the informal survey to kind of help develop the why and to support that. We're also looking to have telephone town halls a little bit later. And we're having individual meetings like these with a lot of groups around the region focused on those, you know, who kind of fall through the cracks sometimes in terms of those who need transit the most and essential workers that are relying on transit right now. So we're going to be we have been doing some e-blasts and we'll continue to do those. And we'll also, unfortunately, have to do some virtual town halls versus actual public meetings. And we hope to do those later on, probably like in the September timeframe. So with that, I think that ends our presentation and we can open it up for any questions.
So I'll go ahead and jump in with a question if anybody else doesn't have one real quick. I actually have two questions. One is for you, Christina. I work with a group of ambassadors who help people learn how to use technology apps in order to access transportation. And one thing that they've really requested, and I know I've sent you this email before, is showing a video of how people can ride the bus during COVID times. Because there's a lot of mistrust and there's a lot of people are just really scared about going on the bus. So I know that you had that video that you guys created about moving our region forward together. But is there anything in the works to do like more of a human-centered, like profiling somebody going through the steps of riding a bus like during COVID?
You know, something officially as we did the Let's Get the Region moving, that was more of like having our video production team come in and do that. But are you maybe saying something a little bit more organic in terms of, say, even featuring one of our writers coming in and showing the steps? Is that more along the lines of what you're thinking?
Yeah, something that's much more like human-centered, like just, you know, even just talking to somebody, maybe somebody who's an older adult or somebody with a disability, like, you know, what are your barriers and what makes you feel safe riding the bus? Because that safety aspect is really what's keeping a lot of people at home at this point. And I think that there's just a lot that we can do to like reassure people.
Yeah, we can certainly look at that. And I think, Angel, you and I had talked a little bit, and we can take it offline too, but that maybe, was this the one where you can help us with maybe some people to chat with or to feature, so that we're not featuring just the RTD employees, but having the real world people in there?
Absolutely. We have some of the ambassadors on the call today, so I'm sure we can find some of them. Be willing.
Wonderful.
I see Jen nodding her head. She'd be willing to talk.
Wonderful.
Yeah, so we could definitely connect you with people, and we have a meeting. The third, I believe it's the third Thursday of the month. So if you want to, I can invite you to that if you'd like to talk to people.
That sounds good.
Okay, great. And then Bill, this question is for you. I have a question regarding fares. And so just generally speaking, it seems like the fare policies that RTD has adopted don't necessarily encourage maximum ridership, right? They're complicated. It's challenging. I work to try to help people understand the fare structure every day. Just trying to get people to ride the bus, and, you know, just letting people know if it's a local route versus, you know, a regional route, and if it's a 3-hour pass versus a day pass, and then whatever demographic group they might fall into. It's just super complicated. And just generally speaking, when we're talking about like behavior change, like simplicity is our friend, right? And then this is not even really addressing the affordability issue. So during your next phase, are you all going to look at the fare policies and really look from like a behavior change standpoint, like how you can maximize ridership?
We'll be talking about fares at a high level, but we won't be getting into the level of analysis that we did, with the past program working group and the kind of the predecessor to kind of the fare change that was done in 2016, I think, and I might be getting the dates, I can't remember that. I think, maybe it's 2019, but when it was implemented, because that was, again, a different focus and reimagine, we hadn't intended to do that, but we will be talking about fares at a high level, more of what you were talking about, as a way to talk about it from a behavioral standpoint. I know, fares are a big issue with our board, and I know that there's been an ongoing conversation with them, especially in light of our budget situation, about how we're going to be approaching fares. So I think kind of a little bit of reimagine, but I think the board's going to be having that ongoing conversation as well.
Okay. And then also you had mentioned that you're going to be data driven. One of the data gaps that we haven't really been able to get information on is how many people at the Boulder County level are signing up for the LIVE program, right? So in order for us to be able to promote the program, we don't know how many people were utilizing the nonprofit pass program prior. And there's not that data transparency about how many people have signed up. And I realize that there's like structural limitations on that because you have Denver Human Services administering that program for you, so you don't have access to everything. But is there a way that we can request through RTD just basic data on how many people have signed up for LIVE and like how we can better support you all in promoting that?
Sure. I don't know the answer to that question. I know, Christina, I know you've been working this too. I can try to dig into that and get back to you, unless, Christina, you have an answer, because I don't know
Well,
that.
For the first question, yes, we could definitely look at that. And in fact, Jyotsna Khatri on our team is going to be able to dig into that right now, she said. So she could look at it as far as the data points go. As far as helping us promote LIVE, that's definitely something that we would love to take everybody up on, whoever's able to assist us with that, because we realize that, even though we've got a lot of channels to push it out through, it really is more effective when they hear from you who are in the communities and you guys are sharing the information and spreading the word. So as a matter of fact, we are wrapping up right now the first production component of our LIVE video series. And this will be available in English and Spanish. And it's going to be a series of 3 bite-sized chunks, if you will, of the LIVE video, an introduction, how to apply, and now that you've gotten your LIVE card, this is the things that you should know as you start getting to use it. So this is based around a lot of the feedback that we got, a lot of the initial questions that we were seeing coming through the pipeline of people, applying, and they were getting kind of hung up in one spot of the application process. So this is based on our frequently asked questions. We should see that towards the end of this month, and we'll couple that with social media push. Again, it's a shareable video, so everyone who is a partner should be able to get that through our website and share it through their channels wherever they like. And we will continue looking at how that's working and how it's affecting our applications. So we are taking a look at the data behind it. And as we see, we could add a little bit more of a push if there's some sort of a paid campaign for social media that needs to be put in around that, we will move forward with that. So it's going to be in bite-sized phases. We're learning the new reality of the new COVID. We were planning on being out in the community, talking to people face-to-face and really introducing this. This is now a shift in gears, and this is where we could really use everyone's assistance in getting the word out.
Great, thank you. So I want to read a question from the chat. So Carrie Murphy from Boulder Housing Partners is wondering, with the statistically valid survey, will you be weighting populations that have low response rates, such as Latinx populations, and how will you be weighting those?
I can answer at a high level, and I'll also ask Julie Skeen, who's also on the calls with the consultant team, if she can add to my answer. But what we're doing is the way we're approaching the statistically valid surveys, we are looking to represent the RTD ridership population. So we are looking to represent kind of how the population looks and feels from a demographic and standpoint. In addition, I would say to address some of your issues, I think the way that we're approaching this survey is a little different than I know I've seen in the past. Usually it's either a phone survey or something that is suspicious. We're doing a combination of a mail survey and then online survey, which I think is more effective at reaching some hard to reach populations. So we're encouraged by that. But I don't know, Julie, did you have anything to add in terms of the specifics for how we're approaching some of the kind of the low response populations?
Well, my understanding is we're not actually waiting on the front. What we're trying to do is actually using zip codes, actually identify certain populations to then make sure that our sample size is actually reflective of the overall current ridership of RTD.
Okay, great. So this question is for Bill, I believe. So during the service cuts that you had due to COVID, there was a promise from the board not to cut access ride service during that area. So as we move forward, and likely, as you had said, in January 2021, we're likely to see continuation of the COVID cuts. Are access to ride service areas still going to remain the same as they were pre-COVID?
That's interesting you mentioned that, because that's an issue that came up at some of our earlier meetings. And we're going to take that to the folks at Access-a-Ride and to the board in terms of that specific comment. That's ultimately a board-driven decision in terms of how they approach Access-a-Ride in terms of the ongoing service and service issues that we have. So, but again, they were the ones that approached it in the COVID situation, so I'm sure they'll be willing to listen. But we are taking that comment forward.
Okay, great. And then also in the comment section, we have a question about people experiencing homelessness. And I'm going to add to that question that Carrie had added. So when you're surveying people, how are you going to reach people experiencing homelessness? And then also we could see a huge spike in people who are experiencing homelessness as the rent moratorium expires because of the CARES Act. And then also, how are you reaching homeless populations with the LIVE program? Because that has been consistently barriers, or people who have consistently experienced barriers to accessing LIVE, in addition to domestic violence victims. So I know that's like pile on, like 3 different questions. But one, how are you going to reach people experiencing homelessness in your survey? And especially gearing towards the fact that there might be even more people experiencing homelessness starting this month due to the CARES Act expiration of the moratorium, and then also promotion of the LIVE program for homeless and domestic violence.
So one of the things with regards to the survey that we're doing, we have sent it out. We are in the process of sending it out to some of our nonprofits, and we work with a lot of homelessness providers, and so we will be working with them to get that survey out. The other thing I would say, just in terms of RTD and how we're looking at homelessness, and I'll even let Christina maybe talk about the marketing for the LIVE program, but we've established a homelessness task force. We know it's a huge issue within the agency. On this task force, we've engaged a lot of several homelessness providers around the region to really look at the issue holistically, and that's something that we take very seriously, and we've looked at things from safety and security to how we deal with our facilities to other issues. So we are really taking this issue, but I know that it's a challenge for everybody regionally, and again, we're no different than everybody else, and we're trying to take it head on. But Christina, I don't know if you can talk to any specifics on the LIVE outreach, but I know we've been talking a lot with the providers about it in terms of marketing the program.
That's right. So the very same groups that we've been working with on the homelessness task force are some of the same groups that we've been working with for the LIVE outreach. And so part of it is working and having the consistent dialogue about the program with them, making sure that they've got the materials as we roll it out so that they can partner with us. We also were looking at having what we were calling at the time a roving worker. And this person is to be somebody who's from Denver Human Services that we bring on board as part of a separate contract. And that is still in the works. I know that it has encountered some delay because of everything that changed with COVID, but my understanding is it's still in the works. Now this person would rove to the different facilities and have a sit down time, so to speak, to help people walk through the application itself. So they would be helping people firsthand, taking in their information. The challenge for us was, as staff, we're not trained to do those applications through the PEAK program. But the other challenge that we're experiencing is we would then, if it was staff, then we would be handling people's personal information or having that information on us, and we couldn't provide the security for the personal documents that, say, someone at Human Services could and is trained to do. So those are some of the things that we had been looking at. We also had been in conversation, and this is, also very new still, but in conversation on how we might be able to work with the nonprofits to have some sort of way in which they might be able to do a temporary card, if that's possible. That is still something that's going to require a lot more work as far as staff goes. How might we be able to accomplish a temporary card? How might we be able to get these nonprofits to maybe print them on site versus us, again, having to mail these out? So these are all things that we are looking at, and it's really a lot based on the feedback that we had been getting from working with these nonprofit organizations as we move forward.
Great, thank you. So I want to be cognizant of time. We are 1 minute over at this point. So I want to thank you all for taking the time to speak with us. This is a really great presentation by RTD. I know that there's a lot of bad news in here, at least from our standpoint. And we have included the survey in the newsletter that we sent out. So if you are an LCC newsletter recipient, please find that RTD Reimagine RTD survey in the newsletter that I sent out earlier today, and take that, and you can also share it with your clients. We need to make sure that people have their say in the whole process. And I just want to thank you all for all the work that you're doing. I know Christina and Bill, I know that these are very uncertain times, and I know that there's lots of pressure pulling you in all different directions, but I just really want to thank you for taking the time to reach out to the LCC. I know that we support what you're doing. I think that maybe sometimes, like the grim reality of the funding source, we don't necessarily have solutions on how to get out of that, and that is frustrating, I think, from just a human services standpoint sometimes, to see transit routes cut, and just how that real world impacts our clients. But I just want to thank you and just acknowledge the fact that I know it's a challenging job that you're doing, and thank you for your time.
Thank you.
Thank you.
Okay, well, thank you, everybody. I'm going to go ahead and close off our discussion. I really want to thank everybody for participating, and I want to thank our panelists, even though I know that a lot of people already hopped off. It was a great ADA panel discussion, and I will be sending out the video to everybody who participated, and then a couple of other people on our other distribution list so that they can rewatch it. But thank you, and I hope you all have a wonderful day.
Thanks.
Bye-bye.